this week. Yesterday, 1,131 Iowans were hospitalized due to COVID-19. 89% were adults age 50 or older. Patients hospitalized where it is specifically due to COVID-19 account for about 15.2% of the census, and patients who test for COVID, but it's not the primary case, so all COVID patients, it accounts for about 21% of the census across the state. But the overall increased patient volume is stressing our healthcare system, and it is putting capacity at risk. Surge plans are in place, and while beds still are available for patient care, staffing them is becoming increasingly challenging as some healthcare workers may be sick or in quarantine or caring for other family members. The situation has the potential to impact any Iowan who may need care for any reason, whether for COVID-19 or for some other serious medical condition. And we don't want anyone to be turned away from our hospitals. As I said last week, these trends cannot continue, and it's critical that all Iowans do everything within their power to stop the spread of the virus now. Like so many states, we've reached a point of serious community spread, and we can no longer pinpoint any one age group or type of activity that's driving it. The virus is spreading easily between people as they gather together in groups or go about their normal activities, especially when preventative health measures like masking and social distancing aren't being followed. Because of the high level of community spread at this time, we're vulnerable to the virus even in casual gatherings with friends, neighbors, and extended family members. I know, again, as I said last week, we're all experiencing pandemic fatigue, but we just can't let our guard down just because we're getting together with people that we know or doing things that are most familiar to us. Even then, we're still putting ourselves and others at risk. The things that seem the least threatening are some of the highest risk activities right now, like wedding receptions, youth sports, even having some neighbors over to watch a football game. If we want to protect our healthcare workers, keep our businesses open, and our kids in school, and our hospitals open, now is the time for every Iowan to carefully consider what more that you can do to prevent being exposed to the virus and further spreading it. Since the beginning of the pandemic, I've said that I dial mitigation measures back up when conditions warrant, and that time is now. Today, I've signed a new proclamation that continues the public health emergency for another 30 days. And the proclamation imposes a number of additional public health measures to reduce the spread of COVID-19. Effective at midnight, any social, community, recreational, leisure, or sporting gatherings with more than 25 people indoors or 100 people outdoors will be prohibited unless all people over the age of 2 wear masks. Groups of individuals who attend these events together are limited to 8 people unless the group is from the same household, and all groups must still maintain social distancing from other groups at the event. Additionally, at indoor youth and high school sporting or recreational activities, only 2 spectators per youth athlete or participant are permitted to attend. The new 8-person group limitation also applies now at bars and restaurants, where distancing of 6 feet between groups will continue to be enforced, and patrons must be seated to consume food or drinks. Masks are now required to be worn by employees and customers at businesses that provide personal services, including salons, barbershops, massage therapy, tattooing, and tanning. Bowling alleys, pool and bingo halls, arcades, indoor playgrounds, and children's play centers are now required to ensure groups are limited to 8, unless, of course, they're from the same household and all groups, again, must maintain 6 feet of distance while in the establishment. Reducing the spread of COVID-19 in the workplace is also critical. And while many employers have extended work from home status for their employees, I'm also ordering that all employers again evaluate whether more individuals can work remotely and enable them to do so to the extent possible. Finally, the proclamation strongly encourages all Iowans to consider how their actions impact the spread of the virus in their communities. I know that getting life back to normal is what Iowans want, and we've managed to get things back to normal already, even if they look and feel a little different yet. You can still eat in a restaurant, you can still go to a movie and work out at a gym, and in many states you can't do that. Iowa is open for business, and we intend to keep it that way. That's why it's time for these additional mitigation measures. But it will take all of us doing everything we can to stop the spread of the virus and keep it at a manageable level that we can live with.